The nation's top health officials say the U.S. is making progress in responding to the coronavirus outbreak. Doctors Anthony Fauci, Robert Redfield, Stephen Hahn, and Brett Giroir testified before the Senate Health, Education, Labor, and Pensions Committee Tuesday. They discussed the timeline for a coronavirus vaccine and increased testing. While the doctors expressed optimism, they also said it will take time to rebuild the nation's public health infrastructure. Meanwhile, House Democrats unveiled their proposal for a fourth coronavirus aid package. But House Republicans say the $3 trillion plan is dead on arrival. And the Supreme Court began hearing arguments on 3 cases involving President Trump's personal finances and taxes. Skylar Henry is in Washington with the latest.
And there are several checkpoints.
Dr. Anthony Fauci warned against reopening the country too soon as he and other top health officials appeared remotely before the Senate Health Committee.
If states or cities or regions, in their attempt, understandable, to get back to some form of normality, disregard to a greater or lesser degree the checkpoints that we put in our guidelines, there is a real risk that you will trigger an outbreak that you may not be able to control.
Officials say they're working to help states get the capabilities for more testing and contact tracing, and the CDC director says more guidelines for reopening states that the White House reportedly suppressed will be published soon.
As we work through the guidances, a number of them go for interagency review and interagency input to make sure that these guidances are more broadly applicable for different parts of our society.
Dr. Fauci said a vaccine could be ready by late fall or early winter.
We have many candidates and hope to have multiple winners.
But the FDA commissioner, Dr. Stephen Hahn, could not guarantee an eventual vaccine would be available at no charge for all citizens.
Sir, the payment of vaccines is not a responsibility of the FDA, but I'm glad to take this back to the task force.
House Democrats unveiled their new proposal for another massive coronavirus stimulus package. They're calling it the HEROES Act.
The measure includes funding to state and local governments, hazard pay for frontline healthcare workers, and additional direct payments for many Americans.
This is an historic challenge, and therefore momentous opportunity for us to meet the needs of the American people.
The House is scheduled to return to Washington Friday to debate and vote on the bill. Skylar Henry, CBS News, Capitol Hill.
Joining me now are Ed O'Keefe and Jeff Mason. Ed is our CBS News political correspondent, and Jeff is a White House correspondent for Reuters. Ed, let me turn to you. So the chairman of the Senate committee, Republican Senator Lamar Alexander, said, quote, "All roads back to work and back to school are led through testing, treatment, and vaccines." Where do Republicans and the Senate as a whole stand on increased funding to help with that?
Well, they would point out that the legislation just passed, the CARES Act, has now about $11 billion that the White House said yesterday will be distributed to the states to help pay for testing if they meet certain requirements. Some states might get up to $500 million in assistance from the federal government for this. So we'll see whether or not there's a request at some point to include more money. But clearly there was some concern today among Republicans and, of course, Democrats about how testing is going. Most notably, Mitt Romney really singled out Admiral Giroir there for the comments that he's made, sort of suggesting that testing is going well. Romney said, not at all. How can you say that? And so I think what you saw today, and remarkably, this is the first congressional hearing on the federal response to the pandemic in the almost exactly 2 months since states started shutting down. It took 2 months for them to arrange for this. And there were obviously a lot of concerns about what's going on. And clearly today, all 4 witnesses still a little sensitive to the fact that they have a president they report to who might have been watching quite closely.
I do want to play an exchange between Dr. Anthony Fauci and Kentucky Senator Rand Paul. Let's go ahead and listen to that.
As much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. But if we keep kids out of school for another year, what's going to happen is the poor and underprivileged kids who don't have a parent that's able to teach them at home are not going to learn for a full year. And I think we ought to look at the Swedish model, and we ought to look at letting our kids get back to school. I think it's a huge mistake if we don't open the schools in the fall.
I have never made myself out to be the end-all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence. The fact that we don't know everything about this virus, and we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. For example, right now, children presenting with COVID-19 who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. So again, you're right in the numbers that children in general do much, much better than adults and the elderly, and particularly those with underlying conditions. But I am very careful and hopefully humble in knowing that I don't know everything about this disease, and that's why I'm very reserved in making broad predictions.
You know, Jeff, it was really striking to see the nation's top infectious disease expert essentially say there's still so much about this that we don't know, especially when it comes to children. But how are the points made by both Senator Rand Paul and Dr. Fauci playing into the White House's reopening guidelines?
Well, I think Senator Paul certainly articulated something that would be something that the president would probably agree with in some ways. The president, that said, I would include the caveat that the president has listened to Dr. Fauci, has listened to Dr. Birx and the other members of his task force when making decisions for the country and forming guidance for states. But the president is very eager to get the country reopened, and that seemed to be the same sentiment that Senator Paul was expressing. I did think it was unusual the way he sort of took on Dr. Fauci, who has really become quite revered, and that was not really something that we saw from the other senators at today's hearing.
Right, and to do so over this question of children, and as Dr. Fauci pointed out, this inflammatory syndrome that is still just emerging even now, months into this. Ed, how are Republican lawmakers trying to challenge top health officials? What's the strategy behind that?
It's unclear what the strategy is, but clearly there was a little pushback today, as most notably there from Senator Paul, who's also Dr. Paul. And frankly, in my years covering him and researching him, is someone who didn't always get along with his medical colleagues. So perhaps what we were seeing today is consistent with the way he comports himself at hospitals. He's an ophthalmologist by training, and like I said, has been known to butt heads with some of his medical colleagues. But I also thought it was notable later in the hearing, Senator Loeffler, the junior senator from Georgia, made a point of asking all of the witnesses whether they had ever really clashed significantly or had some adverse relationship with the president specifically. And all four of them said no. Fauci reiterated what Jeff just said there, that the president takes his advice. They don't always necessarily agree, but that there's no reason to think that they've had a bad relationship necessarily. Certainly there's been stress. I think we've seen that. We've seen the disagreements expressed publicly between them. But Fauci especially, and the other witnesses as well, said they had no reason to think that they have a bad or adversarial relationship with the president. Part of that is designed to poke holes in the arguments that Democrats have been making, that they believe that the response has been botched, that it isn't going well, that the president and his administration is not valuing or listening to the recommendations of medical experts and scientists. Clearly, some of that today was designed to say, hold on a second here. You know, they're dealing with something that's unprecedented. They're figuring it out. And it looks like the White House is working well with these top medical officials.
Well, I also want to play some of what Dr. Fauci had to say about states reopening without meeting federal guidelines. Here's what he had to say about that.
What I've expressed then and again is my concern that if some areas, cities, states, or what have you, jump over those various checkpoints and prematurely open up without having the capability of being able to respond effectively and efficiently, my concern is that we will start to see little spikes that might turn into outbreaks. So therefore, I have been being very clear in my message to try to the best extent possible to go by the guidelines, which have been very well thought out and very well delineated.
So, Jeff, give us some context here. What has been the messaging from the White House on how states should proceed with their reopening plans?
Well, it's a good question. And, Dr. Fauci, as I sort of referenced earlier, was a part of the group, the task force that put together the guidelines for states, along with Dr. Birx and others on the task force. And the president, of course, endorsed those guidelines. But he has not been insisting on them when states have not been ready or have not met necessarily all of the criteria laid out in those guidelines, but have still proceeded to open. The president has been deferring to governors. And that's sort of the opposite message of what Dr. Fauci just said there. He's encouraging people, encouraging leaders in these states to continue to really only do this in a phased-in approach and do so when they can be sure that the state is ready and would be ready if and when the virus comes back.
So, Ed, where does that leave governors? How are they dealing with what appears to be mixed messaging from the federal government on reopening?
Well, it's been a patchwork of response. And I think, to Jeff's point about, governors in the White House, the one governor, of course, the president did criticize, one Republican governor that he criticized, was Brian Kemp of Georgia and his decision to move ahead with some reopening of the state's economy. A new poll out this morning from the Washington Post and Ipsos finds he's only got about a 39% approval rating in his state because of that, because residents there believe he moved too quickly. So there is a political cost to be felt by these governors if they cross the president and they happen to also be Republican. On the flip side, Mike DeWine of Ohio has an 86% approval rating. Jesus Christ doesn't have an 86% approval rating in Ohio. That's an enormous number in a state that, is one that can go both ways, but certainly has credited the governor in recent weeks for his quick response and his decision to start shutting parts of the state down even before other more affected states had done so. So, in my conversations with people who work for these governors, they've said, the federal government clearly is lagging behind. The one example from this week, if you need one, because there's one almost every week, some officials I spoke with yesterday saying, finally, the administration is catching on to the fact that we need to be doing more testing at long-term care facilities and nursing homes, as they asked the governors to do just yesterday. Many of the states have been trying to do that, but as New Jersey's Phil Murphy pointed out to the vice president and other administration officials on their weekly call yesterday, we're having issues in nursing homes with isolating patients who are positive from the rest of the population. I mean, those are basic issues. It's May. This has been going on for 2 months. And the fact that these kinds of concerns are still being conveyed to the White House, and the White House doesn't seem to have a way of sorting this out with the states, is just a sign of how difficult this response continues to be. And again, political fortunes of those in the states that are running this will vary depending on how well their residents consider their governors to be responding to the situation.
Jeff, I want to ask you about Dr. Fauci talking about the death toll from the coronavirus. He was asked about this, and he said that the numbers are likely higher than what's being reported. How does that line up with what we have actually heard from the White House on that?
Well, I don't think that's something you would hear the president say. The president has made a point of saying sort of the opposite. I mean, he's suggesting, that the numbers are so high in the United States compared to other countries because testing is greater here. He has cast doubt on figures in particular from China. I think that he has. I did actually ask him recently in the Oval Office if he believed the number of deaths that had been reported, and he didn't cast any doubt on those. But he certainly, I think, is not somebody who would be suggesting that maybe it's higher than reported. And also, just to sort of tag on to what Ed said and really laid out very well earlier. I mean, this is an example of Fauci speaking truth in a setting that was very politically charged, but still not wanting, and I think this applies to the others who were speaking today too, not wanting to alienate the president that they work for, but still maintaining his credibility in this case by saying exactly what he thought.
Ed, let me ask you about some other news. The Democratic National Committee voted Tuesday to allow delegates to attend this summer's nominating convention remotely. What more can you tell us about that?
Yeah, just about an hour ago, what's called the Rules and Bylaws Committee of the Democratic National Committee, essentially the folks that lay out the rules of the road for how the party picks a presidential nominee, agreed to make changes that essentially would allow delegates to show up remotely not necessarily in person if needed, and to allow the convention organizers to start making changes without checking everything with the DNC if they feel the need to do so. This still has to be ratified by the full Democratic National Committee, the governing body of about 450 people across the country that run things for Democrats. But it's a signal, and it's the first official one from either of the two parties, that the way they nominate presidents or presidential candidates has been completely transformed by this pandemic, and that it is likely we will not see the traditional quadrennial celebration of these parties, which essentially ultimately amount to basically big photo ops over 4 days. That won't happen to the same extent this year, at least for Democrats. Now, this afternoon, Republicans were saying through the president's daughter-in-law that, in fact, they are continuing as planned in Charlotte for the Republican convention. But even that organizing committee has hired some medical professionals to help them figure out what exactly would be acceptable and prudent when they meet in August. But bottom line, Democrats now making clear the way you've seen it done before isn't necessarily the way it's going to be done this year. The plan is to still hold some kind of in-person event of some kind, unclear how big, in Milwaukee, the host city, the week of August, I believe it's August 17th, somewhere in that week. But it won't necessarily be that sort of arena show that we've come so accustomed to watching over the last 40 to 50 years.
It'll be a huge difference. Before we let you both go, Jeff, I do want to ask you, because you are there actually in the White House, just about what the atmosphere has been like here in the last 24 hours or so in the West Wing. You know, we saw in that Rose Garden event earlier in the week that the senior staff was wearing masks. This is not something that we had seen before. I know Kayleigh McEnany, the White House press secretary, was asked about not wearing a mask in the briefing that took place today, and she talked about the fact that she has appropriate social distance from everyone in the room and that she had been tested both yesterday and today. But tell me, Jeff, what is it like? Because, you know, you talked about being in the Oval Office the other day. You're wearing a mask. I know there are temperature checks of reporters that have been going on for quite a while. Tell us about what the atmosphere there is like. Does it feel different now in the last 24 hours or so since we saw the president's personal valet, as well as the spokesperson for Vice President Pence, being confirmed testing positive for COVID-19?
Yeah. Yes, I think things have changed here, and it took a while. Just last week, as you were referencing, reporters were wearing masks in the Oval Office, in the event with in the East Room that the president had with a Republican congressman and women, and none of them had masks on. He certainly did not have a mask on. I remember asking him last week, right after Katie Miller, the vice president's spokeswoman, got sick, if people were going to start wearing them. And he said, yeah, people already are. Well, that just was not true. People were absolutely not. And now they are. And you saw that in the Rose Garden yesterday. Jared Kushner, the president's son-in-law and senior advisor, had one on. You're right that Kayleigh did not have one on when she stood at the podium today, but the other two press people who were with her and sitting on the side did wear masks throughout the briefing, just as reporters did. So I think there has been a shift, and I think that is because of those two people who were so close to the president and the vice president having come down as positive for COVID-19.
All right, Jeff Mason and Ed O'Keefe for us. Good to see you both. Thanks for sharing your insights with us. Take care.